Ontario Premier Doug Ford and the Health Minister Sylvia Jones revealed shortening wait times by expanding community surgery and diagnostic center. In fact, Ontario expanding private delivery of public health care services in three-step plan. What are your thoughts on this solution to a problem that has been much debated in the province?
Yeah, well, thank you, Nuno, for the question. Look, I think it was a terrific announcement. It's all about making healthcare more accessible to more people, quicker and closer to their homes. We have a lot of people waiting in Ontario for various procedures like MRIs and CT scans, but also cataract operations and other things. And we want to make sure that we deliver care, healthcare to those people more quickly, because sometimes if you're waiting for an MRI or a CT scan, you don't know what your diagnosis is, you don't know what your treatment options are, and you can't get on with your life and get well again. So the announcement is really to try to speed those things up for people in Ontario. And what we're doing is we're expanding existing clinics. So in Ontario, we already have about 900 clinics that offer CT scans, MRIs, X-rays that are privately run businesses, but you pay with your OHIP card. So many of your listeners probably will already have used some of those clinics. And also cataract clinics like the one the announcement was made in yesterday, I guess it was, by the minister and the premier. That clinic has been there for many, many years. These clinics have been established under every government of every political stripe in Ontario's history, so under Liberal, Conservative, and NDP governments, and their licenses have been renewed every 2 to 5 years by governments of every political stripe, Liberal, NDP, and Conservative. All we're doing is making them do more of these procedures and operations so that we can get more people treatment quicker.
Very well, MDB. But from your point of view, are there risks of healthcare in Ontario being privatized or not?
Yeah, I don't like the words private, public in relation to the healthcare discussion, because it's not clear to me that everybody is on the same page about what those words mean. As the Premier made very clear, this is healthcare paid for by OHIP. You will pay with your OHIP card, not with a credit card. And so what most people are concerned about is, how is it going to be paid for? Am I going to get coverage? Is there a chance that other people get to go ahead in the line, queue jump? And that does not happen here. This is all available to everybody through our publicly funded healthcare system. And the same doctors, nurses, technicians that do these things in a hospital can do these things in clinics as well. What it does give us is more of a system. And so a lot of doctors, for example, Dr. Andy Smith, who's at Sunnybrook Hospital in Toronto, near where I am, he said, look, they've had a lot of great success shortening wait times for patients by working with clinics to provide some of these lower risk procedures outside of hospitals. Our hospitals certainly have been under a lot of pressure through the pandemic, especially. And this is something that can be done outside the hospital, and it can be done very effectively and efficiently.
Let's talk about the pandemic a little bit. The worst flu season seems to be over, but COVID-19 cases are on the rise again. According to Toronto Public Health, are new restrictions measures on the way in Ontario?
Well, we always listen to our chief medical officer of health about, what we should do with respect to measures to deal with COVID, to deal with flu, and to deal with RSV, which was having a big impact on children. But, I think given the basic layer of protection across Ontario, with many people having been vaccinated, especially older people who are more susceptible to COVID, we're in a pretty good place right now as far as dealing with COVID. We do anticipate always in the winter that there will be a rise in cases. RSV was taking a lot of the attention, and frankly, a lot of the cases were RSV cases for a while, and it does seem that there's a little uptick in some COVID cases now. So I just would encourage everybody to take normal precautions. As we all know by now, get your vaccines, wash your hands, try to stay away if people are sick in your family, let them recover. And don't go to work if you're sick. These are important things to make sure we all stay healthy. And nobody wants to, I think, go back to a situation like we had before, where we have to shut things down and completely change our lives.
A month ago, nearly 80% of Ontarians believe healthcare across the province is in a state of crisis. I read the statement according to a poll conducted by Environments Research. What are your thoughts on current healthcare system?
Well, I think our healthcare system has performed well throughout the pandemic. Obviously, it's been challenged throughout the pandemic. We've had lots of challenges, but so has every other healthcare system in the world. And if you remember, if we go back with a little history, when the pandemic first started in Ontario back in March of 2020, Ontario did not have enough personal protective equipment because what we had in storage had not been rotated. Governments had not changed it over time. And so a lot of it was expired. And we didn't make our personal protective equipment here in Ontario. But the Premier said, that's not good. We need to fix that. And so now my understanding is about 70% of all the personal protective equipment used in Ontario is now made in Ontario. And that's just a change since about March of 2020. So that's one problem that the healthcare system faced and it addressed. Then the next problem was we didn't have enough adult ICU beds. So what did we do? We added 3,500 beds to the system. And we're in the process of adding another 3,000 beds to the system. And those beds were made permanent. So what I'm saying is we faced a challenge and we addressed the challenge. We did it with the personal protective equipment. We did it with the ICU beds. Remember, when we first started testing for COVID-19, we had to do those PCR tests, which were more complicated. And the public health system in Ontario could only do 4,000 of those tests. But we managed to bring together a network of tests and laboratories across the province, and we got up to 100,000 tests in a day. So when our healthcare system has faced challenges throughout the pandemic, we have responded and fixed any problems we were having, and the system is now better for it. So I look at that and I take some stock in the fact that we have had challenges, but we've addressed them.